Let's start with this. Many times heart disease has no symptoms, and if you have a heart attack, there's a good chance you won't survive. It's the world's leading killer. But why wait for that to happen? Dr. Rajiv Agarwal says Modern Heart and Vascular Institute can actually help prevent heart attacks if you do this one simple, quick and easy, painless thing. Dr. Agarwal, you trained at the Cleveland Clinic, which is the #1 hospital for like 26 years in a row for cardiology. And the reason why I bring that up is that you've brought your level of expertise to the Modern Heart and Vascular Institute. So it matters who you're dealing with.
Yes, ma'am. Yes, ma'am. Some of the technological advances are on the forefront at the very best places. And like you said, Cleveland Clinic has been #1 for 26 years in a row. And I was very blessed and fortunate to get part of my training done over there with the best cardiologists training me in this field of prevention and early diagnosis of heart disease.
When you say the word cancer, it strikes fear in just about anybody, as it should. But a lot of people underestimate when you say heart disease.
That is correct. Actually, heart disease is by far the #1 cause of death in our country. Cancer is #2, but heart disease outnumbers it significantly. And what we're seeing recently is a lot of younger and younger folks who are undiagnosed with heart disease. And we're here to diagnose these people at a very young age and prevent the future complications.
Yeah. In your title, of course, is Modern Heart and Vascular Institute. As we know, there have been all types of technological changes over the last few years to several years for sure. So when it comes to detecting calcium buildup, you all do it a little differently than some might do it in terms of your scan.
Yes, we have a scanner that's, it's called a 128 slice CT scanner. What that means is with one rotation of the machine, which takes typically 1 second or less, we are able to image the whole heart. Lying down for 1 second and getting the pictures that previously would have required 9 to 10 seconds. So more convenience and less radiation also. So we feel very comfortable doing these scans on younger men and women who have a longer life to live still. It's really powerful technology, Deborah.
Yeah, and what are you looking at when you see that scan?
What we're looking for is premature plaque buildup inside their coronary arteries. The pictures will show if they have mild amount, moderate amount, or severe amount of calcium buildup. And the scientific data has shown that people who have those levels of calcium buildup in their arteries are at significantly higher risk of developing heart attacks and strokes and circulation problems in the future. And a technology that can diagnose that in 1 or 2 seconds at most is just unbelievable. That's the 2020 way of diagnosing premature heart disease.
And with that information, the great thing about the heart is that in many cases, can we actually reverse the heart disease?
They don't necessarily need to reverse a 10 or 15% blockage, but if we can prevent that 10 or 15% blockage from becoming a 50 or 60 or 80% blockage, which leads to symptoms, we've done them a lot of service just to prevent the heart disease without focusing on reversibility, but really focusing on real-world prevention for disease and conditions in the future.
Dr. Agarwal, a lot of people would say the people who need to be screened are the older folks, but as you just pointed out, younger folks have issues as well. So in general, who should come in?
Very good question, Deborah. The main focus is on prevention. So we want to pick up people that have premature heart disease. The ones that would benefit the most are the ones that either have symptoms or have risk factors. What are those risk factors? The risk factors include diabetes, high blood pressure, high cholesterol, smoking, and the main one that we want to focus in on is any family history of heart disease. Anyone that has a first or second degree relative that has had any heart disease, strokes, any vascular blood flow problems, they're going to be at the highest risk. So those patients that have either symptoms or risk factors really should be screened starting at a very early age. I would say really around 40 to 45 would be a good time to start screening for heart disease because it is the #1 cause of death in our country. 1/3 of all heart attacks are completely asymptomatic, no symptoms at all. So you have to be preventive. For example, we don't have women wait until they feel a breast lump or develop breast cancer and then they start getting mammograms. And women forget that heart disease is 30 times more likely than breast disease. We're all supportive of mammograms and all of that, but we want to get the word out about heart disease. If you're having symptoms, it's a no-brainer. But if you're not having symptoms, you still need to get checked out if you have those risk factors.
Yeah, we know there's surgery, but there are other protocols in place, as you've just said, that can really be effective. Prevent, aspirin, cholesterol medications. But there are other things you can do to stop from having to go to the full meal deal, if you will.
Absolutely. We don't want to see patients when their only options are surgeries or stents or a bag full of pills that they walk into our office with. The earlier you find these conditions, you have options. Like you said, aspirin sometimes, and medications are not the only mainstay. We have a board-certified dietitian in our office. We teach our patients what to do and what not to do at home to prevent. We educate them on exercise. We educate them on reducing stress in their life. So we make a more of a holistic approach of prevention and not just relying on pills or technology or surgeries and procedures.
Dr. Agarwal, thank you very much.
Thank you. Thank you.